Breast cancer screening. At the absolute minimum, women are encouraged to get breast cancer screening done at the age of 50 with a mammogram, and we're at least recommending that women get screened starting at 50 every other year. There are certain populations where we certainly would consider getting the mammogram in the 40s, but that decision should be made by the patient with their doctor. I would consider getting screened earlier if you have a strong family history of breast cancer or any other types of cancers that might be concerning to you, whether that be a history of ovarian cancer, a history of cervical cancer, or breast cancer. Most often we are seeing women come in to get evaluated for breast cancer if they have found a lump themselves on a breast exam, a self-breast exam. There isn't always a sign for breast cancer, which is why we always recommend screening earlier before there are any signs or symptoms associated with the disease. But sometimes women can talk about a new lump that has grown. They never noticed it before. They might see skin changes on their breasts, turning orange or pink, or they might even see a little indentation on their breast that they might not have noticed before as well. In some circumstances, women can get discharge from their nipple or even bleeding from their nipple happening as well. So a mammogram is one of the ways that we screen for breast cancer. It ultimately is like an X-ray of the breast in which we are trying to identify if there's any calcifications or precancerous growths on imaging studies. These breast exams, the mammograms, even breast MRIs can be done here on the island, so people don't have to travel away from Ketchikan. We're able to do them here at the hospital. Preventive care is important in breast cancer screening because we always want to catch any signs of a cancer or a precancer before it becomes something large that spreads throughout the rest of your body. With breast cancer screening and mammography, we're able to catch small growths before they become big and bad to cause a woman issues. If you are a cis man, you are still able to get breast cancer. I guess it's a certain type of breast cancer, and that kind of ties into your own family history. So I would make sure that you are talking to the women in your family about what breast cancer risk looks like for you. But as far as the trans community, screening still applies. I think one of the main reasons that people tend to shy away from screening is that they are scared that it might be uncomfortable. But what I can say about the Peace Health team here is that they really try to maximize patient comfort to the best of their abilities. And we always want to let patients know that they're in charge. If at all they're feeling uncomfortable during the procedure, please give us direction. You are welcome to have us stop at any point in time.